All right. Good afternoon, everybody here in the United States, and good evening, everyone in Kenya. I just wanted to welcome all of you to the 96th episode of the On Air Advocate, where at the On Air Advocate, we look to provide education, support, and empowerment for all of those with different abilities, mental and medical illnesses, and their caregivers. For those of you who may not know me, my name is Tammy Flynn, and I am the host and producer of the On Air Advocate, and I am super excited if you are here this afternoon or evening watching this, or if you are catching it on the replay. Now, as we are talking today, if you feel that this information could be beneficial or relevant for anybody in your network or your circle, please hit the share button and share the love with others. Now, today is kind of a special edition here with my friend Hellen, who is from the capital of Kenya. She is the founder of Challenged with Hope. And I have said that I feel like God brought us together. We're 8,000 miles away, and today things got a little mixed up because here in the United States, a little bit over a week ago, we had daylight savings time, and so our time changed, which made us late for you guys. So I am very, very sorry about that today, but now we're on the right time schedule, and we're here. And so, Hellen, I want you to tell everyone a little bit about your background and yourself. And then we'll kind of work our way into what Challenged with Hope is all about.
Yeah, sure. Good afternoon and good evening to the people that were watching us. We are so grateful for you for you guys to join us. My name is Hellen, and I come from Kenya East Africa, the capital city of Kenya, which is called Nairobi. And I am so honored to be here, and I thank God for giving us this platform and this time. I'm a single mother of 3, and my third born is a daughter, my only daughter. So God blessed me with this little girl, but 10 days later, she had some complications, which we were told that they occurred during birth. So we went home. We were discharged after the delivery, and we went home. 10 days later, our daughter started convulsing. So, but that time we did not know it is called convulsing. We thought that she was just choking because of nursing. So we quickly rushed to the hospital, and the doctor that we saw was not a pediatrician, but a physician. So what he told us is that our baby just forgot how to breathe. And we were like, no, how does this come? So we quickly, they did first aid on her, and we went to now her pediatrician. And that is when the pediatrician told us. And when he was telling me about convulsions, I did not even understand what convulsions were. Because here I've just gone through a cesarean section. It is 10 days. My daughter is 10 days old, so I am confused even what is happening. So the doctor looked at me and he was asking, do you know what convulsion is? And because these things are not really discussed in our community because of stigma. So we find a lot of parents hiding their kids, and they don't come out and share their experience. So in case of a mother like me, meets a problem like this, can be able to identify. Right. So we were put in the hospital, and a lot of tests. So I was so shocked. I was actually very, very disturbed, and I did not understand what was happening. So I kept asking questions from the doctors, but they did not give me any answers. So what we did is that we were discharged because there was nothing that was detected from her, and we went home. So 3 months later, the convulsions came again, and this time it was for a longer period. So I got really, really scared and asked the doctors, why did you not give me the information that I need? But that is when I found out that doctors do not have time to explain all these things to you, because one, it takes time to diagnose. And a second is that there's so many patients with very little doctors. So that means the time frame that you spend with a doctor is not enough for a doctor to explain everything to you. So that gives you a lot of confusion. You do not know where to start or where to get information, so you turn to Google, and that is what I did. And the information I got there was not what my daughter was suffering from. So I went through a lot of problems to try and to understand what was happening. And so my daughter started therapy and medication. So, but I think I just thank God, because he gave me a lot of courage. And So I was even the stronger, because my ex-husband by that time was crying, but I was the stronger one, because from me, something told me in my mind and my heart that, this has happened. If I start crying right now, my daughter will not get the attention that she needs.
Right.
So what I did is I thank God, because I got stronger, and I was able to, I said, it's okay. Whatever has happened has happened. So what is the next thing that we're supposed to do? I asked the doctor. And the doctor told me that we need to start therapy and all that. So we started therapy when my daughter was three months old. And yeah, so we did it for 2 years.
Okay. So, and that was like therapy, physical therapy, for
Occupational therapy.
occupational therapy.
Yes.
And I know from our discussion when we had our long conversation that one morning, you were telling me that there really hasn't been there was no real ending to this. It basically, they said she's okay, but there really
Yeah.
wasn't any diagnostic because of the lack of resources and diagnostic equipment where you are.
Yeah.
It's so different than here in the United States, in the fact, because she's been discharged now, right? Where she no longer needs the therapy.
Yeah, she no longer needs the therapy, and she's off medications as well. So she has recovered. I'll say she has recovered fully.
Okay. But
Yes.
but the doctors, there was no follow-up, because you talked about, you did a few EEGs, right?
Yes, we did. We did three. We did three EEGs.
Okay. And
Yes.
how long there, when they're doing an EEG, do they do it for?
It was a procedure that took about 10 to 20 minutes. But then now my daughter had to be sleeping. We had to put her to sleep, which took longer. So we were in that office for almost an hour.
Okay. And so
Because
for folks that are listening here,
Mhm.
United States, a
Yeah.
normal EEG here is about 4 hours in length.
Okay.
And a lot of times you can be kept overnight or for days to really see that brain activity. Because
Mhm.
what did they end up giving her an actual diagnosis?
Yeah, you see, you've just mentioned that in your side, United States, a parent can sleep overnight, but here we do not have that kind of system, because we don't have those kind of facilities.
Right, and
Yeah.
resources.
Yes, and resources. So what happens is that you have to physically put your child to sleep, because because it's a center that has been like a room. They can't move all those things to a ward. So you have to go there, and you have to get the EEG done, and there's a lot of parents also waiting for the same thing. So they have to hurry. So the resources and the things that the health facility here is not really like how USA is, the United States.
Right. And that is where me and you connected so heavily, for me to
Yes.
learn
Yes.
that, we, a lot of times here in the United States, we definitely are pretty aggressive forward to be like, we need more resources and more opportunities, and, doctors spending more time and all of that. But when
Yes.
when I listen to what is going on there, we
Mm-hmm.
have a billion times more going on,
Exactly.
and
Exactly.
so the lack of resources, the lack of people even having the ability to get on the computer, to look
Yes.
things up on their own, or if they're getting services. So tell us a little bit about that, for how Challenge with Hope kind of came about, and some of the struggles. You're talking about your one struggle with your daughter, but some of the other struggles some of those families are seeing, the thing that you're seeing within your group.
Yeah, thank you. How challenged with Hope came about, it was when I did not get any information that I was looking for. I did not meet parents who were going through the same thing that I was going through. I looked up on the internet, but I could not find. So I spoke to whenever I used to take my child for therapy, because I changed therapy center for 3 times, I guess. So whenever I go and I meet the therapist or the receptionist and all that, I always engage a conversation with them, and I would ask them if they know any support group. that would cater, that has parents who are going through the same thing, that I can join so that I can understand what is going on. Because I'm not understanding, there's no diagnosis being made. I'm just being told that take your child for occupational therapy, take your child to the doctor's appointment, this and all those things are happening. So, but I could not find any. So one night I was sitting and my daughter was sleeping, and I was looking at her, and I was trying to get some information online, and a thought just struck my mind, and I was like, I'm a parent who is looking for support. Right. And I cannot find. So that means there are a lot of parents who are going through the same thing that I'm going through. So why don't I take that initiative and open or start an organization that will support parents? So that's when I went to the hospital that I used to take my daughter for therapy, and I went to the management and I said, this is the idea that I have, and I'm sure you have a lot of parents here and they're looking for the same thing. So I remember at that time there was a conference going on from some physicians from the United States that they had come. So I was invited there because even the hospital did not understand what I wanted to do. They thought it was something like how you go to a psychologist. It's only like you're given time frame like 11 weeks or 10 weeks for you to recover. So they thought that was the kind of thing that I wanted to start. But so they invited me and I went, and I said, no, this is not what I want to start. What I want to start is something that will be monthly support group meetings. Mm-hmm. So when they fully understood what I wanted to do, they gave me an opportunity. So that is when I started, and I started with about 120 parents that came for the first meeting. So that showed me that there was a need for that. Yeah, so that's how the challenge with hope was started.
And now within that group, I know you've discussed with me some of the struggles in two layers. So one, what are some of the struggles you're seeing that parents are significantly having? But then also that struggle of how do you get the resources and the knowledge and the information to those parents? So if we can kind of talk about that in two layers.
Yeah. All right. The first is the lack of information, and the way it takes time for you to understand what is going on. So for newly diagnosed parents, let me say that, is that they go through a lot of problems, a lot of stress to kind of understand what like their lives have changed. Because when you get these children, your life changes. Mm-hmm. So they do not get somebody to like now put them in that mindset of what they expect, how their life is going to change. Mm-hmm. And what are they going to do, what they're going to go through, which doctor to go through, which therapist, where, how much will it cost for this therapist, because here it's very, very expensive. Very expensive. And some of this condition needs maybe for a child to go for therapy like 2 or 3 times a week. Mm-hmm. The cheapest that you can get for therapy is about $60, which is 600 shillings. And that you don't even get enough. Your child does not get what is needed, really.
Right. So you're paying out of pocket. So parents have to pay out of pocket for all of that. It's
yes.
not something that is covered by insurance. And that's something I found shocking too, is there isn't any outside government support. So you're not under any disability insurance, where then that's picking up some of that slack as well for parents to have the funding source to see the doctors.
Yeah, there's some insurances that they have started recently to embrace the therapy and the speech therapist, but they do not cover fully. So you'll reach a point as a parent to dig into your pocket to pay for some services that are needed, because some of this insurance do not cover the full package of your therapies that are needed.
And this is not just when we're talking about therapy. When you were talking about x-rays, EEGs, like all of that is a paid out of pocket. It's not just a given that you are going to go and that it's going to be covered.
Yes, exactly.
Okay. And go on.
So so it gets very expensive here, because a lot of things you have to pay out of your pocket. and there's very, very little resources, and also the kind of economy that we are in this country is not very friendly. So it is very hard. You have to earn for you to get these services. So if you don't have a job, and if you don't have an income, then you're going to go through a lot of problems. And those are the parents that I'm targeting, actually.
And so those parents that possibly their children were born with different abilities, special needs, and maybe they can no longer work because they have such medical complications.
Yeah.
There is no outside funding source for them to pay for their child while they're home with them.
Yeah, the most of these parents lock their children inside their houses alone so that they can go and try and get they can go and earn money to actually come and buy food. And that food is not like, I know those parents who are able, you are being given a diet plan. So you're a parent who does not have an income, who is not employed. So what you have to do is now to leave your child inside the house locked by themselves, go and try and find menial work, and then come and feed your child. And whatever you're feeding your child is something that is not supposed to. It affects the child more because of the diet plan that is required. So that is very, very sad, because a lot of kids are being locked inside for the parents to go and look for money. So that ends up also
uncared for and left alone because of lack of.
Yes, because of lack. Because most of the parents have also other children. So these other children need school fees, they need to be taken care of, they need food, they need to pay their house rent. And so they can't really afford to stay at home. They can't.
Right. And since there is no supportive service like that,
Yes.
there really is no option. And I know the further we discussed is that
Yeah.
everyone that is there has the opportunity to have internet access. So when you're talking about support groups, looking stuff up on Google, trying to see if there's other doctors across the United States and find out information that way, those parents lack having the resources to be able to do that. And that's kind of where you're going with Challenged with Hope, is that what are you trying to create with Challenged by Hope in your area?
Okay, so Challenge with Hope is now 3 years old. When we started, we had 100 parents, but we went down to 47. This is because parents they don't have time to attend the support group meetings. Some of the parents, some are going to work, some maybe time difference, and other problems as well. So I wondered what was happening. And I figured out is that now the parents that I'm left with are the parents that do not have access for internet and getting resources and all that. So these are the parents that are really, really going through problems. So they cannot afford even 3 square meals at home. And the internet access in this country is a lot of money. You have to pay a lot of money per month. Or most of them, there's no coverage for internet in their sites, because where they live is like slums, if I can put it that way. Because they're underprivileged. So there's no actually internet access in their homes. So they have to buy mobile data. And mobile data here is very expensive. You buy like a $10 worth of bundles, and you cannot even watch a live video. Like the time that we have been streaming so far, you cannot watch all that time.
For $10.
So you
very
exactly for $10 for that is, which is very expensive. So now they are in their home, so they actually need, and this is a 24 hours thing, because your child can get a problem, or you can get an emergency in the middle of the night, and you don't have anybody to reach out to. Where you're living is, maybe the security is not good. Where you live, you do not have money in your pocket to even take this child to the hospital. Because I remember one time, if I can share this story, there was a lady that lost her child. She was 13 years old, and she had cerebral palsy. So she had an emergency at night, and it was very hard for her to get a vehicle or even an ambulance because of where she lives. The ambulance cannot access to where she is. She didn't even know anybody that she can call. So the people that she knew were her neighbors and some other parents that they meet at a school or the therapy centers. So she had to stay with her child till morning so that she can take this child to the hospital. So this child ended up passing on, and it was very sad. So those are the challenges that they go through. So they can't get information, they can't get doctors to go to them, they can't get a way to get money so that they can even take the child. Because if you go to a hospital in this country, they demand for you to give them a deposit before they attend to your child. They'll just give you a first aid. But until you pay the amount that is required, they cannot treat your child. So it is really hard for parents here. So there's a lot of things that are needed here. It's like a therapy center where you get maybe funding so that they can get the therapy for free. And you have a doctor or a neurologist that you pay, and the neurologist can attend to the parents. Another thing is because of the cost of the internet. So a lot of parents do not have information, do not even know what to do. Like there's a parent I met, and her daughter had albino. It was an albino. So what happened? She did not know that this child is supposed to be. You're supposed to apply sunscreen on their skin, otherwise they start crying because of pain. She did not know that. So it is really hard for these parents. So if for my where Challenge Youth Hope is going now is now getting a call center, to put a call center helpline in place, which is going to be free. I mean, when you're calling, which will have an 800 number, that it is free for parents to call because they do not have money. So they call, and then we get help for them. They can get help, then they can get support. They can come for their support group meetings. We can visit them and see where they have problems and try and help them. Because some of the parents are really, really suffering. They're tying their children on trees like animals because they do not know what to do with them. It is very, very sad because they have to work. So if they leave them,
right,
they might even go and bang their heads or get hurt or do something. So they have to tie them like animals on the trees so that they can get time to do other chores in the house. So it is really something very sad.
Right. So when we look at our kids here and the sources that we have, you have every layer of lack of resource. That comes down to, even when we talk about the doctors, you were talking about that only like one time a year doctors from the US come and do a conference.
Yes. Because you see, the doctors that we have here, they are not even enough. Like, for example, I'll talk about speech therapists. Speech therapists in this country, we have, I think, below 10. And the population of these children that needs speech therapy is like, I think 50%, if I'm not wrong. So a lot of kids, parents just have to, wait for their line, wait for their opportunity to meet the speech therapist. And even when they meet the speech therapist, the time that it's needed that you need to spend for the child, for the treatment to be effective, is very minimal. So if you're supposed to go for 30 minutes, you'll only go for 10 or 15 minutes because there's a long queue of people waiting for the same service.
Right. And I know that one of your missions is to possibly be able to get parents some of the right information so that then they could help their child with therapies on their own at home, because obviously it's more of like a crisis of having the amount of doctors, the crisis of having funding, of having resources, because you don't even know that your diagnosis is the right diagnosis if a doctor has only spent 5 minutes with you, and if you haven't had doctors that have seen multiple cases of this and that do tons of research on it. And so I know that that's one of the big things, is how do we get some of that information, so if there isn't the physicians, if there isn't the doctors, the therapists available, parents can at home, right? They can help their child on their own if all those resources can't get there.
Yeah, so one of the things that I do actually in the support group meetings is that I look for people that are working in the same line. So like physiotherapist, let's talk about therapy because that is the main issue. So the therapy, because it's expensive. So what I did is I look for therapists who come and volunteer their time to come and teach the parents the basics of what they can do. So if they don't have money to take these kids, to their children to the therapy centers, what they do is that they do it at home by themselves. So instead of this child sitting there waiting for mommy to get money or daddy to get money to take me to a therapist, mommy can do the therapy at home.
Right.
So yeah, I get those people who volunteer, even doctors, even neurologists, they volunteer their time to come and teach these parents, because we cannot sit and wait for them to get money. We can, if we hold hands, that's why I like to use the term that it takes a village to raise a child. So if I can get people, volunteers who can come and teach these parents just the basic needs, so that this child can move from maybe from point A to point B, it is better for them than just staying there. So those are the things that we normally do at the support group meetings. But yeah, we have neurologists, yes. But the diagnosis, like I'm talking about myself, the diagnosis took a long time. So you go to a doctor and the doctor says, no, we're not seeing anything right now. And that I know it is because of the facilities that we have are not like the facilities that you guys have there in the United States, because it doesn't take time for diagnosis to be made. But here it takes time. Like I remember my child, for her to be diagnosed, we had to go for therapy, medication, a doctor's appointment for close to a year for us to know what was wrong. I remember there was a therapist that actually told me that my child has a mild cerebral palsy, and my child didn't have cerebral palsy. My child had convulsion disorder. That is what she had. But you see, the doctors did not tell me. So I went to a therapist and asked the therapist, what do you think? Because you have been attending to this kind of children for a long time. If you look at my child, what do you think that my child has? So she told me, go to Google and search mild cerebral palsy. So a parent like me who does not know that, what I did is I told myself, let me look at what cerebral palsy is, because before I go to the mild one, so that I know what my child is suffering. So you see that those kind of misinformation uh, breaks parents, and actually it's not the correct diagnosis.
Right. And if they're getting misdiagnosed, I would assume then the rate of a lot of children getting sicker and not getting the help they need is pretty high in your area.
Yes. I've met a couple of parents who are saying the same thing, that, oh, I was told my child has cerebral palsy, but actually he's autistic.
And
So I
that
went to another doctor.
is a
Sorry.
question. Is there, no, I'm sorry. I know we're trying to do this up and back.
Okay.
For autism, obviously here in the United States, that is a huge, kids being on the spectrum, and tons of information on that and research that is done. Is that even something that is touched over in your area, or is there really not much of any talk, doctors, information on that?
They're very minimal. They're very minimal, I'll say, because I get parents asking me a lot of questions. So I'm always looking for information so that I can actually now pass it to the parents. Like I know a few days ago I had come to you and asked you about stem cell therapy, because there was some parents in Kenya here, they've gone through that stem cell therapy process and it's actually working for them. But when I got a parent who sent me, because we have also a WhatsApp group um, on WhatsApp. So this parent sent this information on the group and asked me, what do you think about this? So I said, I'll get information and then I'll come answer you. I cannot answer you based to what you have just shared. I have to get the real information from physician and from people who knows more about this stem cell before I can advise you to go ahead with it.
So
So
for
yeah,
that
information
in
are
your
very
area,
minimal.
is there a place that does that? So if some people are getting treatment for that, is there children's hospitals as well as adult facilities as well? Or is it
There's only
all combined?
one. There's a lot of hospitals are all combined, but there's only one hospital that is a children's hospital. But they don't do that stem therapy session there. So they have to be flown to India for the treatment.
Okay. So, and that would you say that that would be for some of the families that are well off are able to do
Exactly.
that?
Exactly.
That is where that population would come in. So by doing a
Mm-hmm.
call center, the object is that you would hub and get the information for those
Exactly.
people, but then they would be able to call in. And that's when we talked, I just felt as someone who has been in the different abilities community for over 2 decades, just such a
Mm-hmm.
call to action, like we need change. I mean, how can we be here with all this information and research and technology, and we don't think it's enough, and we have, an other areas that can't even get in to see a therapist for 10 minutes, or don't know what to do, have no resources, books, things to, learn on, brochures, and no way to navigate as the parents, that helpless feeling that so many parents must feel, like they want to do better for their child, but there's no resources or information to do that, because those people that you look for the information from are your doctors, your pediatrician, your kids' schools, all of that. But if they don't have the resources to pass on,
Mm-hmm.
where does one get it from? You
It
know?
is, yeah, it is very hard here for parents because personally, the parents that I deal with are those parents that cannot afford 3 square meals. So meaning, they whatever even they get from their work, most of them they just work in farms, and whatever they're getting is not enough. So they can get facilities, they can get treatment, yes, but they're very expensive. They're very expensive. So they cannot afford it. So these are the kind of parents that I'm dealing with. So they take them to government hospitals.
Mm-hmm.
And the government hospitals do not have the facility to cater for all these parents because the population here, most of them are poor. Most of them are poor. So these poor people, they have to take their children to these government hospitals, which do not have enough doctors, they do not have enough resources, they do not have equipments, like let's say a standing frame. Like you'll get a hospital with like a single standing frame, which is supposed to service like 30 children in a day. And so what happens is a child needs to stand there for an hour for the treatment to be effective. But now, because of the long queue, a child will only stand in the standing from for 20 minutes, which is not effective. So you just go with your child the same way you brought them. So it takes longer for, even if there was a correction to be made or to be done, now it creates more damage than treatment. So we need resources, we need therapy center, we need even homes. Like there's a time I wanted to start a children's home so that these kids that are being tied on a tree at home can get somewhere to come and stay. Even if it's a day, their parents can go and find work and work and then come and pick them later. So instead of these kids being tied on a tree, they can spend in a loving home where they can get food, good diet, and rest and
Right.
get treatment as well. So there's a need for a children's home. There's a need for a call center where you can get information, and like you can get, where can I find a doctor? Where can I find a therapist? How much is it? I
Right.
have an emergency. Which ambulance can I call? How can you help me? You see? And also there's also that depression that people go through, parents go through. because you see, you lack information, you're confused, it breaks marriages, you know. So
Yes.
you go through depression. So once you're depressed, you cannot even help your child. So there's also that moral support that, you know, we need counselors. So in the center we will have counselors, we'll have information. It will just make their life a little bit easier.
Yes, and you were talking about the stigma there,
Mm-hmm.
that there's a lot of stigma around if you have a child with needs, where they experience like alienation, right, from others in your group if you have a child. So a lot of people don't openly speak about if their children have needs.
Yes, a lot of parents do not speak out. There's some, actually, the cases of parents locking their children inside their houses so that the neighbors cannot see is rising by the minute because of the stigma. So there's stigma everywhere because of lack of information, lacking of information. Parents, people actually, generally, even those people who do not have children with who have special needs, they do not understand. Like, there was a time that we saw a child in one of the public transportation, and you know, he had a meltdown, and people were not, they were not aware that this child has a condition. So
Mm.
they were actually pointing at the mother that, you know, they do not know how to raise their children. Their children are behaving badly. So that made me realize that, you know, a lot of people do not know even what autism is, what cerebral palsy is. You
Right.
know, they think that is something like witchcraft that has been done on the child, so that the child has been, you know, with that condition. So there's also that lack of information, you know, just to go out there and tell people these conditions are like this and like that through events and all that. But so people, the stigma is on the rise, it's everywhere. So it's really, really bad. So parents, they do not talk about these things, they hide so that they cannot be judged.
It's like on every single level, you know?
Yeah.
I mean, it's on the level of you as a parent and, you know, embarrassment and hiding, and then you're not being able to care for your child. So here now you've had your child, and, you know, our job is to protect our children at all times. And we're not able to do that because we don't have the resources and we don't have the information, and there's not even the places to go. Do you guys ever have, I know you said once a year there's a doctor's conference. Have you guys ever in your area or even in surrounding areas that have more money, have any type of special needs type conferences where people from the United States that are maybe advocates, you know, work with families, come in to help parents learn how to navigate better at home, to get organized, giving them resources and information?
From what I know, from the information that I have, is through one hospital that brings physicians or volunteers from America,
Mm.
and they come and they help parents. They teach them, they give them information. There's a question and answer moment, so parents get to learn about that, which is free, but it's not advertised. And there's also a problem of transportation, you know. If a parent lives because where the hospital is and where the parents live, it's quite a distance. So a parent will just stay at home, it will prefer to stay at home and use that money to buy food. So you see, if we have places, if we have connect people coming from America to come and teach these parents, even visit their homes, you know, if we have volunteers coming from America to come and actually teach these parents, help these parents understand things like that, it will also help a lot.
Well, Helen, we need to make this happen.
Yes, we need. Oh, yes, we need. Oh, yes. Oh,
We
yes.
need to figure out how we're going to put that together. But
Yes.
for right now, where things are, kind of your your mission at this point with Challenge with Hope is to start with that call center, and to
Exactly.
and gathering the resources and all the different creative ways that you can do that. And I know that we kind of were speaking, you have internet access, though many in your group do not have internet access. So that
Yeah.
might be something where if you're having a group meeting, we could have some of our doctors and people in the medical profession, advocates, whatnot, on possibly a live or a group, together, so that maybe we could tackle some of those questions, more of question and answer. But I am all about being creative. So if anyone is listening to this right now, or if you're catching it on the replay, I know that I would be so grateful, as well as Helen, if you have other ideas, if you have other resourceful things. Obviously, in the coming months to come, Helen is going to start doing different fundraising and, trying to get monies towards putting together that call center. But in the meantime, we need to get these families information and resources. And, possibly that could just go through you, Helen, right now. If people have other information, things they want to send to you, where is the best place for them to be able to do that? Would that be through your Facebook page, through Facebook Messenger?
Yes. The only place that I know is that will be best is the Messenger on the Facebook page, which I think you have tagged on the profile. So yeah, that is the only place that you can send, which is easier and quicker. So if I get those information, I can be able to now pass it on to the parents, or I can also, they can pass it on. And I can also, for those who have access of internet, I can do live videos where I can also teach them. Once now I get the information and read and understand, I'll be in a better position to help them.
Right. So if you're listening, the call for that is, if there are doctors within this network, if there are pharmacists, if there are, like I said, people who specialize in different therapies, speech, PT, OT, all of that, and you are open to, doing a video with Helen that you guys could record, then she can take that information back. They may not have access to it, but you're getting her the information needed, and into the right hands. If you have handouts for things, to send them over. But we are going to continue to follow this. Helen is in our private community as well. So that's another way that you can connect in the Honor Advocates private community. And, she may throw questions out there to be able to actively answer them, for those families. But we are going to continue to be creative. But I know that there are thousands and thousands of people that are going to listen to this over time, and you're all creative. And no child. I mean, could you think about that here in the United States, if our children were born and there was no one that had any answers, that you didn't even have the facility to go to, if you didn't even have the therapy center, you didn't have an advocate to call, you didn't have a liaison at the hospital that was going to walk you through things. I mean, we have so much. And like I always say, alone we can do so little, and together we can do so much. And it does take a village. And so whatever we can do. So Helen, kind of in closing, is there anything else that you would like to let the audience know that's listening today?
What I would like to put out there is, if you're listening to me, if you've heard what the parents go through, and you can only imagine what you have and what these parents do not have. So if you have anything, or if you have a way that you can get in touch with me, because so that I can actually help these parents, it will be very, very good. And I know God will bless you, because something like even blenders, to be able to blend this food for other kids, because these other kids do not eat solid food. It has to be blended. So if we can get things like that, it will go a long way, a long way. Yes.
I hear you. Now the tears are going to come in my eyes. So
I know.
We are going to keep up with Helen. I will keep posted if we have group meetings that come together. If you're on my end and you want to reach out to me and say, hey, Tammy, I want to, get involved. I want to give information. I want to set up a live. Obviously, we can use my capabilities through Zoom and what I have to be able to do that. And let's get this started. Let's get some resources into these folks' hands. So I'm so thankful, Helen, that God brought us together. And I'm so sorry that I forgot about daylight savings time here. So I thank you all for staying up late.
Thank you.
It's 9 hours difference there than it is here. I'm going to drop all of your information below. Helen, if there's anything else you'd like to add, you can also drop it below on the Facebook feed.
Okay. All right. I'll do that. Yes. Thank you so much for having me.
Oh, you're welcome. And this is a forever thing. So you're going to be seeing Helen again. So we will keep things updated. Let us know how you can also be part of this. All right. So on that note, if you guys want any more information about the On Air Advocate, you can head right on over to onairadvocate.com, and you can find all of our resources and all of our platforms right there. As well, if you want to become part of the private community, you can head right up to this top of the Facebook page and hit the blue button, and that will take you right into our private Facebook community as well, where you can ask questions and we can interact on a daily basis. Also, as just a side note, today is World Diabetes Day. So I'm wearing kind of my navy blue color, but remember to sport your blue today for World Diabetes Day. So on that note, thank you so much, Helen. It has been a pleasure. You are a blessing, and I'm excited to see where Challenge with Hope is going to go over the next few years. And I know that together we can do so much.
Thank you so much for having me. You're also a blessing, and I thank God for this divine connection that we are having here. I know that together, if we hold hands together, parents over here are going to get help. And God bless you all.
Bless you guys too, and we will all be talking soon. Thank you guys so much for spending the afternoon with us, and thank you so much for spending the evening with us as well. Bye-bye, everybody. Have a blessed day.